All right, so today we're going to talk about how to open glove and how to load a blade. Loading a blade is the first thing that a surgical tech needs to do in any surgery because we can't do surgery without loading the blade. So I'm going to show you how to open glove. We don't open glove to load a blade, but I like to teach you guys how to open glove because we will use that to possibly insert catheters or open glove for other procedures that we will talk about further in the program. So to open glove, you will take your glove pack. You will reach in and just take the pack out. So when you open it, you will see that there are little folds that you don't want to touch inside of. So everything in here is sterile. So I want to stay on the outside of this. I'm going to take that and fold it that way so that it will fold flat and stay. I'm going to do that here as well. Now if you look here, there are two folds. You see this one's already popped up for me. That one's there, so you want to take it and hold it just within an inch of that border because the inch of the border is unsterile, but everything inside the 1 inch is sterile. So you want to open that and kind of pull on it so that those folds will hold that open. You want to walk your hands up here and kind of fold that out so that it stays open, because if it pops back on itself, it's not going to be sterile because you've already touched this 1 inch border. If that pops back in, then that would make what's inside that package unsterile. So to go put on your sterile gloves, where can you touch this? So you want to touch what your skin's going to touch. You're going to grab it here, pull up and away. You're going to work your hand in without touching anything down there. Leave it like that and let it go. You cannot pull that down because this hand is not sterile. That glove is sterile. So to put the second glove on, I'm going to take 2 fingers and walk that in this glove, holding it up like that, walking my fingers down. So this unsterile hand is going to go in here, and I'm going to put it on. Now, you see my fingers did not go in. That's okay. This hand is sterile. These are sterile. I can then come do that. At no time am I going to pull this down though, because my unsterile hand touched that part. All right, so now I have open gloved. So I'm going to pick that up in the middle where that is sterile. I'll take that out of the way. All right, so how do you load a blade? So the first thing that you're going to do is you're going to get a needle holder or a needle driver that looks like this. So you want to pick your blade up. So this is a 15 blade. You guys are going to have to learn all of these. You see it has an angle right there. It says 15 and it has an angle. So on these needle holders, or the knife handles, you're going to see that there is also an angle. So you know that you're putting it on right if you get the angle correct. So if you were to have it flipped here, you're not going to get it on right. It's going to be harder to go on. I have seen students get them on that way, but it's not going to fit correctly. So the first thing that you want to do when you go to pick up your blade is hold it right here. So you want all of that to be open because that's what's going to slide on the knife handle. And you don't want to clamp it over the sharp part because you can actually dull the blade. So to put that on, I'm going to put this here. There is a little notch. I don't know if you can see that, but there is a notch there where this blade will fit. So you want to go here, and that's on. All right, so that one is loaded. So now we're going to try an 11 blade. This is a number 7 knife handle. Same thing. It has the notch. So you would pull it on. Oop, sometimes that happens. Put it on, and there, that's loaded. All right, so this is a number 4 knife handle. These are bigger. As you can see, this looks a lot bigger. This is a 20 blade and a 4 knife handle. You guys are gonna have to remember what fits on what. So this one goes on the same way, even though it's a little larger. Okay, so this is a number 10 blade. This is the most commonly used blade. This fits on the number 3 knife handle and the number 7 knife handle, as well as the 11 and the 15. There's also a 12 that you can see here. that is your tonsil blade. So all of the 15, 12, 11, and 10 fit on the number 3 or the number 7 knife handle. The number 20 blade only fits on the number 4 knife handle. All right, so now I'm going to show you how to take off the blade. So I'm going to take this 15 blade. So the way that I take these off is I actually turn it over, because what you're going to do is you're going to grab it there and push down and away from you. So anytime that you're taking a blade off, you want to grab it here, just that. You see how I like support my fingers so that I'm not going to go like that. You don't want to jerkily do it. So you want to grab it here, push down, and it easily comes off. Anytime that you're taking a blade off, you want to aim it down and away from you and anybody else that might be across from you. You see how easily those come off. So once again, I steady my hand here, grab the tip of that, and it's one way off. All right, so that's how to load a blade and open glove.